everyone, I am Kimberly, the 5-Minute NP. The 5-Minute NP was born out of my belief that small, incremental changes can drastically change the trajectory of your life. Our genes do not have to determine our lifespan. My goal through this podcast is to act as a roadmap that bridges the gap between knowledge and action, leading to you living your healthiest, happiest, longest life. Welcome to the 5-Minute NP podcast. Hello everyone, welcome to the 5-Minute NP podcast. In this episode, I was honored to interview Dr. Repta from Scottsdale, Arizona, a board-certified plastic surgeon, author, international speaker, and he is well known for his world-class plastic surgery results for the face, breast, and body. He is a leader and pioneer in plastic surgery and in the art of body contouring. He is highly sought after for his innovative and groundbreaking procedures, such as his mesh-free hernia repair and the plus-size abdominoplasty, or tummy tuck, a technique for those who have been told their BMI is too high to be eligible for a tummy tuck. He shares more about this procedure, ideal candidates, risks, and benefits to consider when pursuing this type of surgery. He shares the latest in breast augmentation and the only way extra skin and stretch marks can really be removed. I know you're going to love this episode. Please remember to like, share, and subscribe to the podcast. My goal through this podcast is to help you live healthier, happier, and longer. Thank you for being here, and welcome to the 5-Minute NP podcast. Hi, Dr. Repta. How are you?
I'm doing great. How are you doing?
Good. Thanks for being here. I can't wait to hear more about you. So I thought we would start out with just a little bit about you. And I know you have a huge following on TikTok, and I love your videos, and I love the music. It's so fun. I think I've watched them all. So I can't wait to hear more about you.
Oh, thank you. No, my pleasure. So obviously the nuts and bolts of who I am, a board certified plastic surgeon, been in practice for about 13 years here in Scottsdale, Arizona. Broad training and residency. And then throughout my career here in Arizona through my private practice, have kind of expanded on some of the things that I thought were important, including surgery on patients that kind of were previously thought to be unsafe to operate on, basically the high BMI patients, the plus size patients. Of course, a diverse practice. We do a lot of different type of things, but that's one of the things that I think we've really pushed the boundaries on, and we're kind of gearing up to publish a paper as well on that, just to show everyone that the data, at least from the past, seems to be maybe modifiable, or at least the conclusions need to be rewritten.
What drew you towards that? I mean, just in general, I was going to ask, what drew you towards plastic surgery, and especially those higher risk surgeries that other plastic surgeons weren't willing to take on?
Yeah, I think great questions. And, we never understand fully the depths of our ideas and the history in the past and all that stuff. My parents were blue collar workers from Romania. I was born there. And so, of course, the first thing is when you move to the US is you want to, become successful, whatever that means, just kind of make your own way. And so I went to med school really not knowing what I was going to do, or if that was the right thing for me. Luckily, I came across plastic surgery, and I really fit into plastic surgery like a hand in glove, so to speak. I just love working with my hands, and I love problem solving, and I love the idea that I'm not just following steps 1 through 10, clock in, clock out. It's a head scratcher every single day, and it's an opportunity to really challenge your intellectual abilities, your physical, technical abilities. And in the process of doing so, you really accomplish something wonderful. You get to fix people that otherwise thought they were unfixable. So that's what drew me to plastic surgery. And that's probably what also kind of expanded me into these higher risk surgeries. Basically, it's patients that, from one way or another, they come across me, and they come to my essentially my office, probably hear from other patients and other providers, essentially have running into a dead end street with whatever problems that they're facing. So that's the little summary of how I got into plastic surgery and how I ended up doing higher risk patients. Yeah.
Well, with these patients, I thought we would just kind of jump into like this
Sure.
excess skin. I mean, it can be from weight loss, it can be from having twins or multiples. I know we
Sure.
used to call it twin skin because
Sure.
I have twins. So is there any other way to really remove extra skin without surgery?
Well, that would be the holy grail, and we, of course, have not found that. You know, the skin is such a remarkably complex organ, and of course, you hear all the little facts, and the largest organ, the most important organ, all that stuff, and it's all true. We always forget about it because we always see it and we take it for granted. So, you know, it can do a lot, but it can't do everything, you know? So, you know, weight loss, weight gain, you know, pregnancies, certain environmental damage, smoking, overt sun exposure, take a toll on it, and it loses its ability to retract back. And that's what the definition of elasticity is, right? So, you know, you stretch a rubber band and it snaps back. That's a rubber band with good elasticity. And so when it doesn't snap back as much, that's lost some of its elasticity. And we have not found a way to non-surgically get that elasticity back, to have the collagen fibers kind of basically wind back up. Perhaps in the future, but right now there are no non-surgical ways of doing so. So especially significant skin retraction and permanent skin retraction, there is no non-surgical way of doing that. So you have to basically remove the excess skin, and then when you suture it back together, you essentially retighten it back up.
Well, let's just talk a little bit about the tummy tuck in general.
Yep.
Is that the most popular procedure you do? And is it your favorite? And what goes into it? What are you actually doing when you do this surgery?
Sure. No, absolutely. You know, you know, I have a diverse practice, but with tummy tucks, also known as abdominoplasties, I have a lot of experience with that right from residency and fellowship. I ended up publishing a book called Atlas of Abdominoplasty in the beginning of my practice, actually. And so in that textbook is designed for plastic surgeons to essentially learn how to do different forms of tummy tucks. And each chapter is a different type of tummy tuck, and there's a bunch of chapters in there. So therefore, there's a lot of different types of tummy tucks and all the ways to fix them and fix complications and do revisions and all that stuff. So I feel very comfortable in that realm. And because of that, I also do a lot of abdominal hernias because it's kind of in the same realm. Mm-hmm. So that is probably my number one procedure. And we do a lot of the plus size tummy tucks as well, but also a lot of tummy tuck revisions. And so we have maybe 20% of our patients are from out of the state and out of the country. And we get patients from Middle East, Europe, New Zealand, Australia that come in for tummy tuck revisions just because that's our kind of niche, and we really kind of specialize in that. A lot of things can go into a tummy tuck. It all depends on what type of tummy tuck you're doing, what type of patient you're doing it on, and what the goal is. So I include everything in my tummy tucks. I include the liposuction of the abdomen. I include the muscle repair, the belly button, any kind of hernias that we fix. I include all that stuff in there. Some people don't. They piecemeal it, which is fine. So what goes in depends on what the patient needs. So a plus size tummy tuck requires a lot more liposuction, and the dissection is a little different. But there's some patients that don't have any skin removal. So there's something called an endoscopic tummy tuck. Basically, you make a small incision. The incision is about that big, and you just tighten the muscles and you liposuction, but there's no skin removal. So for example, the endoscopic tummy tuck patient is a patient that's never really gained weight or lost weight, is relatively young, usually in their 20s, has had one kid oftentimes. And so their skin is great. No stretch marks whatsoever, no loose skin. So you tighten up their muscles, but they don't need that big incision that patients that have a lot of loose skin on. So lots of different types of tummy tuck procedures are out there, and what goes into them depends on the patient and what they need.
When you're talking about BMI, I think, we typically think people understand what that means, but what are you considering when you're looking at somebody's BMI?
Well, that's exactly it. So the papers in the 80s, 1980s and 1990s, and even up to recently, they keep looking at BMI, which is just a culmination of two numbers, right? So BMI is weight, height, right? So that's just the BMI is just the combination of those two numbers. And so what they do is these papers is they plot BMI and they plot complications for patients that have had body contouring procedures, and they are correlated. The higher the BMI, the higher the complication rate. But that's a very rudimentary look at whether patients with high BMI are good candidates for body contouring procedures. And we've shown that over the 13 years, we haven't had any deaths. We've only had a few small minor complications. It's just as effective and just as safe as low BMI. If you do them properly, and if you modify your tummy tuck procedure to a certain extent. So for me, a BMI is really a very rudimentary number. So a bodybuilder can have 3% body fat. They're super healthy. They're 20 years old. They have a crazy high BMI because they have a lot of muscle mass. Mm-hmm. That number is meaningless to that person, right? It's not saying that that person's unhealthy. Similarly, a regular patient that has a high BMI, but has no diabetes, no hypertension, no heart or lung issues, and they're otherwise in good health, that person's perfectly fine to have surgery. You just have to modify your procedures properly. The flip side of that is you can have someone with a normal BMI and have very poor physiology, and those people can be very bad candidates for surgery. So a BMI is a very rudimentary number. It doesn't mean that much to me. I take it into account, but I look at the whole patient.
What about, now, do you encourage people, do they need to lose weight before you actually do the surgery? Or does the surgery itself kind of kickstart people into maybe losing more weight?
Yeah, all great questions. And so to take them all in line, I don't have a BMI or a weight restriction. And the reason for that is that's putting the cart before the horse. So the flip side of that is, can I do this surgery safely? Second, can I get a great result? So if I can get a great result and I can do so safely, then we're going to go ahead and do the surgery regardless of what the BMI is. We look at the health issues we talked about. We look at where the loose skin is, how much fat there is, what can be done and what should be done. So that's the answer about the BMI and the weight component. The counseling is always the same. It's, hey, are you living the healthiest life possible, right? So, and I always encourage that, like, don't do a crash diet, try to make surgery, because I could do surgery even without you having lost any weight, but just live a good, healthy life that you can continue beyond that. And the third part is it absolutely kickstarts, and that's the data is coming in. It definitely kickstarts a lot of people's life choices, habits, dietary activity, self-worth. That is also a big component. And I've had a couple of patients specifically over the last 13 years where they came in kind of, quiet and not that outspoken and very reserved. And 3, 4, 5 months later, after they've healed, you could really see a resurgence of this person, that their true self, who they really are, came out. And they ended up, improving their lifestyle, improving the dietary habits, but also improving their professional component. They started businesses and they're successful and all that stuff. So it definitely helps people that are stuck. It's not a weight loss procedure, that's bariatric surgery, but you can do it safely, you can get a great result, and you can really help people.
Yeah, I can see how it can totally build people's confidence. And not only that, just improve their quality of life. I mean, taking all that off and just giving them a whole new perspective on life. It's incredible. And it seems like, obesity is huge right now. We're at the highest rate. And for people over 20, it's crazy. And not only that, just being obese in general puts you at risk for almost every chronic disease, especially during COVID. It puts you at a higher risk of getting it and dying from it. So I can see how beneficial this would be for people overall, just in regards to health, having this procedure. How many do you think you've performed estimately of this procedure?
Well, we're actually culminating that data. Over the last 13 years, we're up to like 240 or 250. I haven't gone through all that data yet, but it's up there. And that BMI ranges. So it's interesting because as I'm going through that data in the beginning, the BMI is the 35s and the 40s. And now 35 and 40, I almost like conceptually think about it as like a normal BMI person. It's not until the number hits 45, 50, 55 that my antenna starts going up more. So we've done quite a few that bell curve for the BMI has definitely shifted into the higher BMI patients. And it's interesting because we're also doing more surgeries too. So in the beginning, that 13-year stretch, we're doing 35 and 40, but we're just doing a tummy tuck. And now we're doing, 45, 50, 55 BMI, and we're doing tummy tuck plus other procedures all at the same time. Same safety profile so far. We've modified our protocols, but same safety profile so far. So it's interesting, but I think that goes to show that with life in general, everything evolves, right? So your understanding evolves, and therefore how you do things evolves. And the fascinating part is that we're not getting any smaller as a population. So this situation is, it's not a small number of people that are overweight, and that number is not static, it's going higher, right? So therefore this topic becomes more relevant, because you can ignore it. You can say, well, we're still not going to do any surgery over BMI of over 30. But that patient population is increasing consistently. So that data needs to be looked at, and it needs to be published. And we need to kind of have a paradigm shift of how we look at things.
I definitely think the higher the BMI, obviously the higher risk factors, the complication rate. What have your overall outcomes been, and what are some of the complications or things that people need to be aware of when pursuing this type of surgery?
Well, it's important to look at complications in probably two categories, right? So you have the local anatomic complications, a little wound healing issues that basically it's not anything that threatens your life. It might be a nuisance. A big version of that might be a nuisance for a month or two. A small nuisance might be for a week. Infections, that kind of stuff. And then you have the other category, which is the life-threatening ones. And that's really the big one on there is pulmonary embolism, right? Deep vein thrombosis and pulmonary embolism. And we've had 3 patients in 13 years that have had at least a DVT or a PE that we knew of. They could have been asymptomatic, but it's only 3. And 2 of those were hospitalized. They were put on blood thinners and they were discharged. But only 1 of those was plus size. Only 1 of those had a high BMI. The other one was a regular BMI, average BMI patient. And so patients that are in general, anyone that's getting any kind of surgery in general should look at the complication profile and just know that that's the risk that you're taking having surgery. So obviously choose your surgeon wisely and choose how you do things properly. And if you're a higher BMI patient, you are a higher risk for DVT and PE, but you can do things differently. If you do them the exact same way as you do them for a normal BMI patient, then you will get into that higher complication rate. So you need to find someone that modifies how they do things so that it keeps the complication profile comparable.
What's the recovery time for something like that, especially with the higher BMIs? Is it a longer recovery time, and what does that look like?
The overall recovery is about the same. So time to go to work, 2 to 3 weeks, time to work out, 6 to 8 weeks, compression garment, about 6 to 8 weeks. But the drain stays in there longer for higher BMI patients, which makes sense. The total surface area between the skin and the muscle is more, and you're liposuctioning it out a lot more. So the body's reacting with healing fluid a lot more. So the drain stays in there longer. Otherwise, everything else is the same.
I've been amazed. I've watched so many of your videos. I just can't even believe what you can do. It's incredible. I know you answered this question on social media, and I think it's a good one to ask because people that do have these procedures like the tummy tuck or even implants, like breast procedures, and then they continue to lose weight, does that mean they will reaccumulate that skin? Will they need a revision at some point, or what happens?
That's a great question. I think it's a mathematical question, though, and it depends a lot on what the skin residual laxity is, right? So I always tell my patients the same way is, I don't know what will happen if you lose 25 pounds or 50 pounds. All I can tell you is in my 13 years in practice, everyone has lost 20, 25, 30 pounds after surgery, because obviously as you're tightening up the abdominal muscles, there's a different satiety reflex there. Your stomach can't really expand as much. Then you're burning all this calorie. There's a little bit of that lifestyle change. So you end up losing, 10, 15, sometimes 20 pounds in surgery with liposuction and skin removal, and another 20, 25 pounds afterwards or more. And I've not seen any additional loose skin. So we know that for the average person, 25 additional pounds of weight loss after surgery is not going to make any difference. But who knows, maybe if you do 50, maybe if you do 75, maybe you will. You'll never go back to how you used to be. Maybe it won't be as tight as after surgery. And you can always revise it. And when you revise it, you don't necessarily have to redo the whole thing. You could potentially just excise a little bit of skin right where the incision at to tighten it up. But so far in 13 years, I have not had anyone had this issue before. So for the time being, the best way to answer that, the most succinctly way to answer that question is, don't really worry about the weight loss and its impact on the skin. unless you're going to lose 100+ pounds afterwards, it's really going to be a non-factor.
I think what's probably more important is they're probably off their blood pressure medicine, talking
Yes.
about their great things. I mean,
Yep.
it's just crazy. Well, moving on to another procedure that you perform is the mesh-free hernia repair. And I thought you could just briefly talk about in general what a hernia is. I mean, it's very common, and how your procedure differs from the traditional hernia repair.
Sure, and I'd be happy to. So the simplest definition of a hernia is there is a weakness or an absence in a structure that separates two cavities, right? Two areas. And so obviously our abdomen, you can imagine like a big bag, right? And then so the inside of the bag is our organs, and the organs have some kind of pressure on our abdominal wall. So they're always, physics is always trying to pull them out. And so therefore it goes where we have weaknesses, natural weaknesses in our abdominal walls, where we have our hernias. And so inguinal hernias are right where your growing are, belly button hernias, umbilical hernias where your belly button is. And then you can have hernias through incisions, and then incisions from prior surgery, or hernia from in the center where the muscles tend to meet, but then they get separated. So those are the common types of hernias. There's others. That old school way of doing it, 75 years ago, is they used to take big sutures and just wrap through them. 150 years ago, they used to put these belts on. Basically, your organs are pushing out, the belt is pushing back in. So it's not really a hernia repair, but it helps with the pain and all that stuff. So we went from belts to big sutures. And then for a period of about 30, 40 years, and even into the present, we use a lot of man-made substances, meshes. And that's because the technology has improved, and all these companies have come up to create mesh products. And basically, when you do a mesh hernia repair, you basically put a patch on a hole, right? So let's say you have a rip in your pants and you put a patch on it. The hole's still there, but there's a patch on top of it. And they do work, but they don't do two things. One of them is they don't replicate the flexibility of our abdominal wall, because our abdominal wall is dynamic. So it adds a static component to it. Second is it doesn't strengthen the abdominal wall, because you still have that weakness in there. So I do mesh-free hernia repairs. Basically, you go in there, you dissect all the scar tissue around the hernia, you put the hernia back in, and then you figure out a way to bring the muscles and the tissues back together. And it all depends on how big the hernia is and where the hernia is. There's different ways of doing that. But the benefit of that is you don't have to deal with a man-made object, right? So it's just you, all your natural tissues. Second is it strengthens your core, because it fixes an inherent weakness in your core. And third, it fundamentally fixes the hernia. There's no patch on it. And the dynamic area of your muscles are uninhibited. So that's the benefit of mesh-free hernia repair.
So it's probably a quicker recovery time, right? Less complicated?
Probably not, actually, because if you think about it, when you put a patch on a hernia, you're not disturbing any new tissue. So in a weird way, you're not really doing that much. You're just putting that patch in there. And so your body doesn't really feel like anything has occurred. When you're doing a mesh-free hernia repair, you're dissecting the tissues out and really bringing back in. So interesting thing, the patients that have had mesh and are bothered by it, when I do mesh removal and mesh-free hernia repair, they come back and they're like, well, it's definitely sore, but it's a different kind of soreness. So the pain associated with the mesh is gone. That is actually a relieving sensation. So instead of this nagging, sharp pain, you have soreness like you just worked out. So inherently, like the mind is tolerating that a little better. But obviously, you're going to have a recovery period no matter what, so whether you have a mesh or mesh-free hernia repair. But the long-term result is a lot more favorable.
Is it less likely to reoccur? Without
if done properly, yes. If done properly, yes. I've had 13 years of practice. I've had only one recurrence, and I almost know what I did wrong in that surgery. Obviously, I haven't gone back in because it's not like a really big recurrence. But if you're getting things back together, the tissues back together, they heal properly. You're really better than you've ever been before, because that weakness, you're probably born with that weakness before, So I suppose with the mesh, it's always, there's a potential for the body to herniate beyond the patch of where the mesh is at.
Mm-hmm. When you go in and repair people's muscles, or their diastasis, and are they able to eventually do ab work, or do you usually say no, don't do any of that anymore? Or
100%. Yeah, it takes a little time. It takes a good 3-4 months before you can start doing that, because you're just so sore afterwards. But you're stronger than ever. Yeah. I mean, once the muscles heal back together, you've never been that strong in your whole life. I mean, like the muscles always have a little bit of separation, just embryologically. And then so when we put them back together, we don't put them back together in an anatomic way where it's abnormal or not natural. We just bring them right back together. And then so you've theoretically never been that strong before.
Wow. Well, I thought we would just kind of do a couple random questions. What about stretch marks? Do you have a lot of people asking if you can remove those with other things, or is it just surgery?
Well,
there's creams, there's all kinds of stuff.
Yeah,
that's gonna work, right?
And lasers and so on and so forth. It falls into that holy grail component again. We don't have great solutions from. You can technically tattoo over them with ink or without ink. You can laser them. You can do a variety of different things to heat up the skin. It doesn't get rid of them. It minimizes them a little bit temporarily, but it's not technically the holy grail. A holy grail non-surgical stretch mark removal is basically treatment permanently gone, definitively gone. And we don't have that yet. Mm-hmm. So surgery is the only thing that we really have that truly removes them. It's interesting, 4 or 5 years ago in practice, everyone was asking about stretch mark removal. I don't know why there were so many consults for that. And now very few people do so anymore. Maybe with time, there was a little bit more education, or maybe the companies that purported to have stretch mark removal marketed more, 5 years ago, and now they just kind of fizzled out. Mm-hmm. So it's interesting. I don't get that many consults for non-surgical stretch mark removal.
Do you feel like people our younger ages are pursuing plastic surgery in general?
I think it's broad across the age range, younger, older, the ethnicity, more ethnicities have accepted it, mm-hmm. More males as well. I mean, it's still predominantly a female obtained service. And a lot of part that because, women take care of themselves more than men. And then there's also childbirth. But I think plastic surgery in general has stepped away from this, maybe like, there's something wrong with you if you get plastic surgery. And now it's just like everything else. Hey, you go to the dentist, right? If you have, teeth you need whitening or straightening, you go to the dentist. So if you need improvements in the way you look, you go to the plastic surgery, for face, breast, body, that kind of stuff. And so it's interesting because even the ethnicities have changed as well. So you'll get traditionally conservative ethnicities that are now also getting plastic surgery.
I was going to ask you what are there any myths related to your profession? Anything that people think that your profession is that you would say is a myth?
Well,
maybe you only do boob jobs, or you only, that kind of thing.
Yeah, that's exactly right. So, I remember when I was in residency, one of my general surgery professors, like there were a general surgery rotation before I did plastic surgery. He said, man, I wish I would have gotten into plastic surgery when I was going to residency. This is back probably in the 50s. He thought it was all just, boobs and stuff like that, superficial stuff. But then he realized that plastic surgery is also reconstructive surgery, putting together faces, face transplants, breast reconstruction, obviously hernia repairs, like I just mentioned. So plastic surgery that's what really attracted me. There is no box for plastic surgery, head to toe. Cosmetic reconstruction, young, old, we have no boundaries. And I love that kind of frontier thought of plastic surgery. And a lot of people don't even know, like certain things, like the first ever kidney transplant, plastic surgery, Yeah. And so I think we're just challenged by opportunities. And so that's the great thing about plastic surgery. There's also a little bit of a residual myth about cosmetic surgery that somehow we're all Porsche driving, kind of guys that, don't want to get their hands dirty. But I guess it's from individual to individual. Like I drive a truck, so I drive a big truck and I love working in the yard and all that stuff. I think that the categories of who we are and what we do have expanded with time, so there's a little bit of everything for everyone.
Yeah, I think you're right. I mean, with all my ER experience and urgent care, I mean, we're calling plastic surgeries for, fingertip repairs and dog bites and all kinds of crazy stuff that people are like, you want to send me to the plastic surgery? I mean, I cut the tip of my finger off, I'm like, yeah, you want them to look at it. You're right. Yep. Well, what is the latest on breast implants? Like, are they still saline? Have they switched to silicone? What's the updates on this procedure? And also, have lifts changed at all? Or is it still the traditional, surgery, up the incision lines the same? Anything changed, updated?
Well, everything's always changing. And it's interesting with man-made objects, and that's why I might move away from mesh. With man-made objects, there's always something unknown because man created something. So there's unintended consequences of your decisions of the type of material and how you build it and all that stuff. And so the implant stuff seems to go cyclical where, everything's kind of quiet for a while, then there's a little bit of turmoil, then quiet for a while, turmoil. So there's two things that are important to discuss for breast implants. One is breast implant related illness, not a completely understood phenomenon. So, some patients have certain symptoms associated with the implants, but the data is not really good to, be able to kind of describe who and how and what. So in my philosophy is anyone that has any kind of medical issues or health concerns where you're not quite sure where those things are coming from and you're wondering if your implants are causing them, well, your health is more important than anything else and your peace of mind is more important than anything else. I always recommend just get the implants out. And if you feel better, but then voila, implants were the cause. And you can always do breast fat transfer or you can always do other stuff. Now, if you take the implants out and you still feel the same, well, you have to keep your search to see what's causing those symptoms, because obviously there's something else involved, whether it's in your own lifestyle or whether it's, medical condition. So that's breast implant related illness. The condition with the lymphoma and the textured implants. So that's also, unfortunately, an incompletely understood phenomenon. The data keeps changing a little bit, but basically the long story short is there's this speculative idea that maybe textured implants can cause, or at least are more associated with this lymphoma stuff. The numbers are really low. I mean, you're like 1 in thousands, right? Mm-hmm. And so that's a really low number. Breast cancer in women, 1 in 8, right? Mm-hmm. Chance of getting into a car accident, this is like 1 in 1,000. So it's a very small number. However, it's an optional thing. So when I have patients come in for breast augmentation, I say, the implants are saltwater filled implant, saline implant, silicone implant, and then you have a shaped silicone implant. The middle silicone implant is round. The other implant is shaped. Now, the reason that's important discussion is that the shaped implant is textured. And you can only get it in a texture, at least so far, because it needs to have that texturing in order to grip the tissues. Otherwise, it spins around in there. Now, a round implant automatically spins around in there, but it doesn't make any difference because it's symmetric. It's round. So that's a discussion that I have with patients. And I tell them, here's your risk for this, and here's your risk for that. And that's an important discussion because you have to educate your patients so they can make an informed decision. Because some patients are rail thin, and they have you can see ribs through their skin. And if they're an A cup and they want to go to a full C and they're really thin and you put a round silicone implant, it looks a little fake, right? And then so even more so than saline, even less so than saline, but still noticeably fake. So their ideal implant for those patients are the shaped implant. So that patient has to decide, do I want to have a fake looking breast or do I want to have a more natural looking breast and take this chance of lymphoma 1 in X number of thousands. And it's all about informed consent.
Okay. So do you prefer the saline? Is there less risk with that one?
Saline and round silicone have the same safety profile because the shell is both smooth. Okay. I do about 1 saline implant pair per year. And that's someone who preferentially wants saline because saline is heavier than silicone and it's also firmer. So if you want a natural breast, you want light and you want soft. That's what fat is, right? So if you put some fat in a container of water, like let's say, chicken fat at home or something like that, it floats, right? Because fat is lighter, oil, right? So oil always floats on water. So silicone implant is much better than a saline implant in terms of natural feel and then the weight of it as well. So I primarily do the round, smooth silicone, but I still do some textured shape implants with the proper discussion and the patient with informed consent and all that stuff.
And then I saw one of your videos, you removing one with scar tissue all around it. So when do most people probably don't even know they need to replace their implants at a certain point. So when should they replace their implants and why?
Yeah, so what you probably saw was en bloc implant removal. Basically, instead of getting between the implant and the capsule, which is the body's collagen formation around the implant, instead of getting into that, taking the implant out, leaving the capsule in, or taking the capsule in secondarily, you just stay on top of the capsule and you remove it all in one piece. So if the implant's ruptured or you have concerns for breast implant related to illness or anything like that, then you want to do that, just so that it's at least a peace of mind that it's all fresh in there. And so, but if you don't, then it's easier just take the implant out and leave the capsule in. That's a whole different discussion that you can go, when to leave the capsule in, when to take it out, and how to manage it. Okay. And then remind me again, I'm sorry. I
just wondered if there was a certain amount of time that you should get your implants replaced.
Thank you. On average, people get their implants removed or replaced in about 10 to 12 years. Mm-hmm. Now, my communication to my patients, my education is, if you like how your implants feel and you like how your breasts look, then you don't necessarily have to do anything. They're lifetime warranty products. Mm-hmm. Now, 10 years is a long time. Our bodies change a lot. So if you're going to have a breast lift, a pocket repair, a size increase or decrease, then now it's an opportune time to just replace the implant.
Okay. All right. So let's just talk a little bit about you real quick. Have you ever been nervous about performing a specific procedure or just not happy with the outcome?
Of course. Yeah. I mean, I'd be either lying or a robot if I was opposite. So obviously, as you can imagine, in the beginning of my practice, their nervous level is higher because you have less experience behind you. Also, the end number of your surgery is less. So if the first breast augmentation or tummy tuck that you do in practice, if it doesn't turn out right, then it's 100%, right? It's 100%. So I spent a lot more time reviewing and thinking and planning. Ironically, is I still get a little nervous before all of my surgeries now. It's a small amount of nervousness, and it reminds me to go through my algorithm of everything that I do and not to take any, leap of faith, right? So the most important part for me is really communication to the patient to really understand what you're trying to accomplish. And then I go through the same sequence. I mean, I become as close to a robot as following steps prior to surgery. Now, the art part, the artistic part comes in when you design the procedure and then how you execute it in the operating room. But everything around you should be very mathematical, very robotic, because it eliminates all these variables and you can focus on the art part. So that's the nervousness part. And then I'm always reminding myself that as soon as you cut one corner, you're liable to cut 2, and then 3, and then 10, and then 50. So I try to not cut any corners at all at any point during any surgery. And that also helps me when I leave the operating room and I think, well, am I happy with that surgery? Did it turn out great? And I use that as an opportunity to learn how could I have done things differently, but you never leave it feeling bad because you didn't cut any corners, right? So you leave the operating room and you're like, well, with that anatomy, with that body, here's what I've learned, but I really couldn't have done anything more, at least at this moment in time. 10 years down the road, when my knowledge gets better, maybe I could have done things differently.
I was going to ask you how have you grown through these experiences? Like, what have your patients taught you? I mean, it's probably like an amazing experience just following these patients along from their before and afters. And it probably just, I don't know, it does something to you.
I love learning. I love seeing my patients go through that process because, the first time you meet a patient, they trust you because they see what you can do. That's the benefit of the videos and the photos and patient, report and all that stuff. But then the second time they come back, you can see that they've really handed over the reins, right? Mm-hmm. So they say, hey, you know what? I'm still nervous, but basically, like, you walk me through that process. That was a huge surgery. Usually the first surgery is the big surgery. You walk me through the first surgery, everything healed perfectly. I'm happy, all that stuff. So it's a little bit more of a partnership where they're like, what do you recommend now? You know, it's a beautiful thing because you can discuss it, like, well, what bothers you and what are your insecurities and what are the things that you're wishing to accomplish? And then you work in tandem to create the next procedure.
Mm-hmm. What are you personally most proud of?
Well, I honestly, I like the idea that every day I put as much of 100% as possible. You never know if you're putting 100% in. And maybe it's not even a good thing to put 100% in, you know, who knows what happens when we ever do that. But I like the idea that I'm not resting on my laurels, and I'm going to do that until I really either physically can't do it or I'm not really inclined to do it anymore. And then I'm going to bow out gracefully, because the financial part, I mean, obviously it's great to make money, but I'm not, at this point in my career, I'm not doing it for the money anymore, right? And so it's been 13 years, and you know, that part has been settled. And so I'm proud of the idea that, you know, there's a little component of that of how I grew up, you know, the kid from Romania, blue collar parents, you know, and I'm proud that I've used that to little stoke my fire to work hard and progress. But I'm actually more proud that the fact that day in, day out, I still got that fire, you know? So I love it. Even today I did a facelift, upper and lower eyelid surgery. And I got nervous a little bit because it's on the face, which is good. And then, you know, you go through that process and you're at the end of it, you're happy that you've seen this progression of skills, but also a little bit of the corner cutting thing we talked about is, you know, we could have been done half an hour ago. I'm going to spend half more hour. I'm going to really detail orient everything else. So I think that's a great part about pushing hard every day, is you see that progress in not only your skills, but your patience and your practice.
I think that's one thing I did notice about you is, like, throughout your videos, I really feel like what stood out to me is that you do seem like you really enjoy what you're doing. And I think that is incredible, because you don't always see that. And you do see people kind of getting burnt out or doing it for wrong reasons. And so I think that's what really has stood out to me, is that you really do seem like you're passionate about what you're doing. And I think that's just incredible for patients, because that's what they want when you're getting major work done.
Thank you.
Like, yeah. So where can everybody follow you? And I know on your website, I mean, people can schedule virtual consultations or in person, right? Because you're located and your practice is in Arizona, right?
Yeah, correct. You know, we have the luxury of being able to be contacted by a lot of different methods. So, I mean, the easiest thing to do is just messages. For example, like if you on Instagram, you can just send us a little message. You can certainly get more information on both Instagram and TikTok and YouTube. Those are all great sources because they all have videos and photos of what we've done. And then if you want an in-person consult or a virtual consult, if you go to our website, drrepta.com, there's a button at the top and you can do in-person consult or virtual consult. The virtual consults work great. You know, we have 25, 30% of our patients are from out of state or out of the country, and they work great. You just take photos, send them in, and we jump on a phone call and we go through all of those. And that could be your first consult, or you can come in afterwards. And then, of course, you can do it the old-fashioned way. You can always pick up the phone and just dial 855-377-3782. That's our main office phone number. But there's a lot of different ways to get educated about what we do, and also a lot of different ways to reach out.
All right. That's awesome. Well, last question. What is the impact you hope to have on the world with your work?
Sometimes I wish I could have had a bigger end number, right? So if you think about it, if you create a company and creates a technology, the technology can, go out there and help more and all that stuff. And so sometimes I think myself, like, I'm never going to have that end number. I'm a one-on-one person, right? But at a much more controlled and higher level quality, right? Because with technology, you essentially birth it and you just let it go out there, and you never know it's going to do good or bad, and it's just out there. But with me, it's a one-on-one, and for now, I enjoy just impacting each individual patient. I think there's a possibility that in the future, some of the things that I'm doing now can be taught and taken on. But I go through. I know how life works to a certain extent. I read these old books from these famous plastic surgeons. I have no idea who they were. I don't know what their personality was. I don't even know what they look like most of the time. So I think it's okay. We're meant to be forgotten, which is fine. We make our impact in our family and our friends and the people in our community. But it's okay. We don't have to be remembered to make life better. We can make life better for people right now, and then maybe somebody else takes the reins later on.
Yeah. Well, I think also you probably mentor more people than just in your practice and teaching others how to enjoy what they do and to work hard for their dreams or what they want to accomplish.
Yep. Thank you.
Yeah. Well, thank you so much for talking, and it's been awesome. And I look forward to following you and just seeing how far you go and learning more about you and sharing you with everyone.
I appreciate the time. Thank you very much.
Thank you.